Europe faces long wait for weight loss drugs as governments eye costs. 1/3. A selection of injector pens for the Wegovy weight loss drug are shown in this photo illustration in Chicago, Illinois, U.S., March 31, 2023. Reuters/Jim Vondruska/illustrations/file photo. Summary. Companies. Novo will launch Wegovy in Germany later this month. Germany bans lifestyle drug coverage by public health plans. Europe's mostly universal health systems balk at drug costs. EU obesity below US levels, but trend is bad. Frankfurt, July 10, Reuters, Novo Nordisk, Noviab.co, will start selling its hugely popular obesity drug Wegovy in Germany this month, its third European market, but only people who pay from their own pocket or have certain private health insurance plans will be able to get it. A decades-old German law bans public health insurance schemes from paying for weight loss drugs, categorizing them alongside pills for impotency or baldness as a lifestyle choice rather than a health necessity. That means the cost of Wegovy, which has a US list price of $1,350 a month, will not be reimbursed for the 90% of Germans covered by such plans. Novo has yet to set a price for Wegovy in Germany, Europe's largest pharma market. Germany's stance on weight loss drugs is among the region's strictest, even though the proportion of its citizens who are overweight is above the European Union average. It highlights the challenge Novo and rivals face in convincing European governments to pay for obesity drugs, which analysts say is likely to slow their take-up there. Some doctors argue that Wegovy could help stem a tide of weight-related conditions such as heart disease or joint pain that are themselves costly to treat. Martin Merkel, a medical professor and member of the German Endocrinology Society, said the drug offered a very, very good opportunity to reduce weight and prevent follow-on disease. How many knees would not have to be operated on if we were all slimmer, said Merkel, adding that pushing diet and exercise alone has shown limited success. Other researchers, including dietitian and senior lecturer Dwayne Meller of Aston University in Birmingham, England, say promoting a healthier lifestyle should take precedence over prescription drugs. Slower than expected. Production problems and a struggle to keep up with overwhelming US demand have already led to a slower than expected roll-out of Wegovy in Europe. Novo boss Lars Fruergaard Jorgensen said in a newspaper interview on June 24 that the Danish company would launch the drug in Germany at the end of July. Germany's health ministry told Reuters there were no plans to change the law to cover weight loss drugs. One lawmaker in Berlin cited concerns about the cost weighing on an overstretched health budget. The lawmaker, who did not want to be named, said expert panels governing reimbursement would review any benefits of the drugs beyond just weight loss, the usual system for approvals. Michael Wirtz, who represents patients at advocacy group Obesity Help Germany, says this is short-sighted. Weight loss drugs could prolong lives and help people stay in the workforce. This is not about people needing to be lean and attractive, he said. Germany is not the only government to impose limits. Public health insurance schemes in Norway and Denmark, the other two European countries where Wegovy is available, will not pay for the drug, arguing that monthly costs of between $160 and $350 are too high compared to the benefits. Denmark's largest private health insurer will also stop paying for it next year due to high demand. French payment schemes will only cover its use for treating very obese people with a body mass index, BMI, of 35 or over, a higher minimum than European regulators indicated when they approved the drug in January 2022. Access in Britain will initially be through hospital specialists and limited to people with a BMI of 35 or over. The government plans to authorize family doctors to prescribe the drug only after a 2-year pilot scheme.